welcome, Laura. So we've got Dr. Laura Wade here today. Do you just want to do a brief introduction?
Sure. So I am a clinical psychologist. I've been working with adults with ADHD for about 8 years now. I'm one of the partners at Attention to Health. And I do both assessments and therapeutic interventions for people with ADHD.
Well, thanks very much. And I was very excited to talk to you today because I noticed that a lot of my clients actually struggle with the whole self-compassion thing. And I know that's a particular expertise of yours. So I've just got a few questions that I think might be really interesting for any viewers that we get. So,
yeah.
Okay, so I'm just wondering how, people with ADHD can develop more self-compassion when they're constantly feeling that they're not, they're falling short in some way.
Yeah, I think it's one of the most sort of common things that I see with people with ADHD, having had really critical sort of life experiences, generally feeling like they're kind of not good enough, or that they're sort of failing in some way. And I think there's the sort of the one sort of way to deal with it, which is kind of a rational CBT approach, which is to sort of try and find evidence against that belief, which is, kind of one way to deal with it. The other one is to take a sort of more kind sort of version of it. And I think it's about changing how you talk to yourself. That's how to sort of develop a compassionate sort of voice.
It's absolutely lovely. And I notice as a coach, as an ADHD coach, one of the first things I say to people as part of my job is to help them stop beating themselves up. So this compassion therapy really fits that model. Are there compassion-based therapies or techniques that are helpful specifically for people with ADHD?
So there's no sort of one therapy that's particularly been developed. There are sort of two kind of schools of compassion-focused interventions. One, which I think is more kind of American, based on what Kristin Neff is doing there, and I really recommend that you check out her website. She does a lot of information and resources about developing a self-compassionate voice, bringing in self-compassionate imagery, so maybe imagining somebody who is a compassionate and kind person to sort of talk to or think about things with. And then there's Paul Gilbert, who is originally from the University of Derby, who's also done a lot of work on this and developed compassion-focused therapy, which again, thinking about not only how to develop compassion, but also to reduce shame and guilt, which are sort of the opposites of compassion. But I think a lot of what people with ADHD can really struggle with.
Absolutely, I can absolutely see that being such a good fit. So some people often ask about therapy, so I think that's very helpful. So why do people with ADHD find it so hard to be, kind to themselves, even when, they do understand that it's a neurodevelopmental condition?
I think part of that is in some ways habitual. It's how other people have talked to them. It's how they've learned and internalized how they talk to themselves. I think one thing that can also keep sort of self-criticism going is the idea that it's in some ways helpful. I need to give myself tough love. I need to talk to myself in a critical way in order to activate a sort of a drive in order to do things like the toughest, most awful personal trainer you can think of in order to get stuff done, because a lot of people with ADHD do really struggle with motivation. However, that might work in the short term, but in the long term, it can really degrade people's kind of sense of self, and activate a much more kind of threat-based sort of system than maybe you want. And I often find that Paul Gilbert talks about 3 systems: your drive, relief, and threat system. And I often think that a lot of people with ADHD are highly stuck in either inconsistent drive and threat, and have very little sense of relief, which I think can be really a shame.
Yeah, that's really hard to live with.
Tough. And sometimes, I can see why people do find that kind of criticism, motivating. I think sometimes it's just about consistently being there for people and positively encouraging them when there is some sort of progress made, because people with ADHD do make progress and can learn how to kind of form new habits. I think it's about sort of maybe bringing in a support system that is compassionate around you to help you sort of become more accountable. And I often find that people with ADHD do have a lot of compassion for others. You know, that is not a place where they're at all kind of lacking. So being able to kind of activate that and get them sort of involved in a group can be, I think, sometimes really helpful with the accountability, whilst not relying on the critical drive.
Yes, absolutely. That sounds very, very positive, and positive support systems and compassionate support systems. That sounds a brilliant, brilliant helpful thing. How many sessions would people need of therapy in your experience? What sort of a helpful amount?
I think it really depends on the person. I think if any sort of psychotherapist is telling you like, oh, we'll need at least a year, I think that's probably far too much. I think a lot of really good work can be done in sort of 4 to 8 sessions. Obviously, it's all dependent on how much the person can afford, in terms of sort of time and money with a private therapist. But I think for a lot of people, they benefit from sort of 12 to even 20 sessions, because some of these things are quite entrenched.
And talking about that entrenchment, my last question, I'm building that compassionate inner dialogue after negative talk for so many years. How does that work?
I mean, I don't know how it works for everyone. I think, as I said, there are lots of techniques out there, either kind of imagining sort of like a compassionate other that can be with you. The way that it works for me personally, and I've got a lot of success from people that I've worked with, is asking myself kind of compassionate questions. I have a negative thought, or I have a belief about something, and I say like, well, how would my best friend ask me about that? How would my beloved grandmother talk to me about that? What kind of questions would they ask me in order to sort of prompt and maybe a different perspective? That's one that I use a lot.
That sounds a lovely approach. So thank you. And I'd love another conversation about this. I feel like we've only just scratched the surface, and it sounds a very powerful way to support people with ADHD. So thank you, Laura.
Thank you, Julie.